Thank you, Madam President. I'm not going to get into a lot of the things that Senator Durbin got into about increasing the lifespan of Medicare or issues that revolve around folks who get charged more just because they're a woman. But I do want to approach this health care debate from a standpoint of how it's going to impact rural America, because it's going to impact rural America in a huge way. And before I start my prepared remarks, I just want to say something. For the last 6 years, I have listened to folks stand on this floor and talk about repealing health care, repealing health care, repealing health care. And now the folks on the other side of the aisle can do it if they want. But for the last 6 years, I have never seen a plan to replace the Affordable Health Care Act. And I still haven't seen a plan. And I'm going to tell you that if we repeal this bill without a plan to replace it, we've got big, big problems in this country. The folks in this Congress who are pushing to repeal without a replacement will kick families off their health insurance, close down rural hospitals and clinics, add $9 trillion to the debt if they succeed. Rather than go down this dangerous path, I have a suggestion. Let's roll up our sleeves and work in a bipartisan manner to increase access and affordability, to lower the cost of care, to bring down prescription drug prices. Tell you, I'm willing to work with anyone, Republican, Democrat, Independent, Libertarian, whoever wants to have a serious conversation about improving our nation's health care system. But I'm not going to allow folks in this body to take us back to the old days, the days where our friends and our family couldn't afford to get sick. But rather than build on the successes of the ACA and fix the problems with the ACA, there are folks in this body who want a full-scale repeal, ignoring any of the progress that we've made. They want to go back to the old health care system. And here's what that would look like in Montana. 152,000 Montanans with pre-existing conditions will be at risk of losing their health care plans. 61,000 Montanans enrolled in Medicaid just in the last year, because that's when Medicaid expansion actually went into effect. 61,000 Montanans will lose their health care coverage. Montana seniors will lose help paying for their prescription drugs. Insurers will be allowed to subject every Montanan to lifetime and annual caps on their coverage. And a woman will lose important protections that prevent them from being charged more for coverage than men. And it just doesn't stop there, folks.